system is working. However, I understand that this is all new, but I do want to just express to Tasmania, it's part of the plan. We always said that COVID would arrive, and importantly, that we would have the systems in place to manage it. Now, the plan was based on having a high level of vaccination, and we have one of the highest in the world. I can inform you today that we're at nearly 96% first dose, 95.9% first dose, and 90.42% second dose for our over 12 population. And even higher for the over 16 population at 97% first dose, and we're closing in on 92% second dose, 91.74% respectively. Now, I've been out in the community this morning and I've been speaking to Tasmanians about how they feel about having to wear masks, the fact that we've reopened. And I can understand that there is some anxiousness, and that's quite okay. This is new as we move forward, but overwhelmingly, I was very pleasantly surprised with the support for the plan that we have in place, and importantly, for us to keep on going. We need to learn to live with COVID, and the support that I received this morning was very pleasing to get. I spoke with shoppers, some retail employees, contractors, even a senior clinician from the Royal Hobart Hospital, and overwhelmingly it was positive in the response. But understandably, in some cases, people did have a degree of anxiety, but that's normal when things change. Now, the messages that that they provided to me were that it's important that we keep on going, that we return to a life where we can live with COVID, and important that we can go about our daily lives as much as possible in the same way that we did around 2 years ago. Now, I couldn't agree more, and importantly, I note that while some people would prefer us to stand still, we need to keep moving forward, and that's what we're going to do. We're now in a position, because we have a high level of vaccination, we have sensible public health measures in place, such as social distancing and the indoor mask wearing rule that we brought in last night, that will enable us to safely go about our lives, but importantly enable us to rejoin the rest of the country. Now, with these measures in place, we can get on with our lives, use common sense and follow the rules. Now, importantly, in following the rules, if you're indoors, wear a mask, socially distance, have good hand hygiene, and cover your coughs and sneezes. And importantly, I want to stress this, we've said this on so many occasions, if you have any symptoms, go and get a test. This is the last week before Christmas. Don't turn up to that Christmas function because you feel that you have to, because you've worked with people all over the course of the year. If you've got symptoms, go and get a test, make certain. It's really simple, the things that we need to do. Now, I want to explain the supports that we have in place for anyone that's identified as a close contact and needs to isolate and doesn't have available leave, or if they are a casual employee that doesn't have any leave at all. Now, you can receive up to $750 per week from Services Australia, and if this is not available, you may also be able to access the state government's pandemic isolation grant of $750. Now, for more information, just go to the Services Australia website or to the coronavirus website and seek those details. Importantly, we want to support you. If you are asked to isolate, there are supports available. If you need to get a test or get vaccinated, or support someone that needs to get vaccinated, such as a dependent or someone that you're caring for, you can access financial support of $250 to go and do that. So that's either getting a test, or if you want to support somebody to get vaccinated. Now, in relation to businesses, we want you to remain open. Importantly, we want you to remain safe, so it's important that you follow your COVID safety plan. Now, as we learn to live with this virus, there will be many exposure sites that are listed, and this will continue to increase. That's a statement of fact. The vast majority are and will continue to be casual or low-risk exposure sites, but there will be some close contact sites as well. Now, these will all be listed on the Tas Coronavirus website as either close or casual contact sites or low-risk sites, as I've just said. To be very clear, if you are a close contact and you are vaccinated, you will need to quarantine for 7 days, and if unvaccinated, for 14 days. Now, Public Health will work with the businesses affected to determine who is a close contact on site based on their risk assessment, noting that mask wearing will mitigate the risk between staff and customers, and staff and staff and customers and customers. And our aim will be to keep people safe, but to minimise the business disruption wherever possible. Public Health will provide advice on whether you're a close contact. However, as I've said, the overwhelming majority of sites will generally be casual exposure or low risk sites. If it's a casual exposure site, which means that the case was there for a short period of time, and if you were there at the same time as well, some of these casual exposure sites are measured in minutes. So make certain that you keep on top of the updates and look at the website, because that'll tell you whether or not you're a casual contact or not. And if you are a casual contact, you won't need to isolate. You just need to book a test 3 to 5 days from the date of your exposure to the case, monitor for symptoms for 14 days after exposure, and get tested if any symptoms occur, even if they're mild. And you'll need to wear a face mask for 14 days following exposure outside the home when you're unable to physically distance. There's no requirement to quarantine if you're identified as a casual contact and have no symptoms. I know that's been a question that's been asked on many occasions, and just to clear it up. Now, if a low-risk site, you only need to monitor for symptoms for 14 days, and if you develop symptoms, get tested, just the standard rules. You're not required to quarantine. As always, you can call the Public Health Hotline on 1800 671 738 for more information. Now, regarding National Cabinet tomorrow, we're going to meet. We'll receive an update in regards to the most recent advice from the AHPPC in terms of Omicron and the public health measures to ensure we can safely live with the strain. I note that there has been some discussion about that advice in the national press this morning. What I can say is that in Tasmania we are in really good shape. We've maintained our public health measures, the density rules, social distancing, caps on venue numbers, businesses to have COVID safety plans, as well as maintaining our Check-in Tas program. And that is so important. Make certain that if you're going out, you're going to a venue, check in. It's going to help our contact tracers, it'll help keep you safe, it'll help keep our community safe. Now, in fact, when I look at where the other states are, I think that we are the best prepared. A number of states have walked away from some of their check-in requirements. They've walked away from some of their density requirements. And in some states, they, as yet, are not looking at utilising masks. Now, and I'd encourage them to do so. That will stop the spread. In terms of boosters, we're rolling out our booster program, and Catherine Morgan-Wicks will speak more about that in a moment, but I'd encourage you, if you're due for a booster, get a booster. And tomorrow we'll obviously be discussing at National Cabinet. A number of premiers have indicated to look at whether or not the program can be shortened again. We'll obviously act on a target advice, and should it be shortened, then we will obviously put in place the necessary program to ensure that we can meet that rollout. Now, the mask rules that we implemented last night put us, as I've said, in a stronger position than most of the other jurisdictions. In fact, I think stronger position than all of the other jurisdictions at the moment in terms of controlling the spread of the virus. And importantly, I know that whilst some people see this as a bit of an inconvenience, it is a very cheap and very simple thing that you can do that will keep your community safe, yourself safe, and importantly those that you love safe. Now, in terms of testing, testing rates continue to be high, with more than 2,050 tests conducted yesterday, and I believe that our laboratory, which Kath will speak more about shortly, processed around 3,000 tests as well. The Department of Health has been working closely with private testing labs and the pathology service to establish additional testing capacity across the state. And from today, I can announce that an additional testing site in the Launceston will be at the Youngtown Primary School car park from 12 p.m. to 5 p.m, further supporting the options for Tasmanians to access COVID testing. Additional resources are being allocated to our call centre as well to ensure that we can manage the increased bookings and traffic that we're getting. Our public health hotline has both call centres running concurrently, the one here in Hobart, the one up at the Techno Park in Launceston. We've already put additional resources in place, and we'll continue to add more resources and more people over the coming week. While there were some callbacks required yesterday, I'm advised that as of 7 a.m. this morning, all callbacks that were required have been met. So, I just want to thank the staff that took a significant volume of calls in recent days for the work that they've engaged in. Now, I want to thank Tasmanians and importantly our staff and those that are working with us. It's been a tremendous effort, but we are at a point where we've done the work. Tasmania has one of the best vaccination rates in this country and importantly around the world. We have our social measures in place. Unlike other states, we haven't walked away from those. The density restrictions are still there. Social distancing is still being applied. Importantly, the little things are the things that we need to continue doing. Make certain that you do socially distance. Make certain that if you're indoors outside of your home that you wear a mask. Make sure that you have good hand hygiene, that you cover your coughs and sneezes. And importantly, don't go to an end of year booze up or a party because you think that you have to. If you're not well, go and get a test. Do the right thing. It's a pretty simple thing, but it'll keep people safe. We have a plan. The systems that are in place are working, and importantly, that plan is working. I'll hand over to Dr. Veach, who will provide an update on the cases.
Thank you, Premier, and good morning. So I'll provide some brief further comments on the 4 cases that were diagnosed in the 24 hours up to 8 o'clock last night. So those 4 cases took the total number of cases up to 14. There were 2 cases diagnosed in the 24 hours up till 2000 last night. 2 were female and 2 were male, and they were aged in their 20s through their 40s. One of those people, we believe, acquired their infection in Sydney. 2 of those people, we believe, may have acquired their infection on flight VA 1086 that flew from Sydney to Launceston on the morning of the 15th of the 12th, last Wednesday. And we think that may be the case because we were aware of a case who was diagnosed after being on that flight, and that flight had already been listed as a close contact site for the people closest to that case and as a casual contact site for the rest of the passengers. So there were 2 cases associated with that flight diagnosed yesterday. And there was the 4th case was a family member of one of those people infected on the flight. Our response to this was to take that new information and reclassify the entire flight as a close contact site, which will require everybody on that flight to have a further COVID test, which at this stage will be about 6 days since their exposure to the flight. And so the Public Health Operations team is undertaking that today. That means that the additional close contacts on that flight will bump the number of cases up of close contacts we're currently managing up to around 300 by the end of today. The people who were diagnosed yesterday have had some public exposure sites both in Hobart and in Launceston and in Devonport. Most of those public exposure sites are casual contact sites or low risk sites, but there are a small number of them that are close contact sites, and people who are at those close contact sites at the same time that the cases were there are amongst those people now being managed as close contacts. The people who were casual contacts at those sites are being recommended to have a test 3 or 4 days after their exposure, and the people who were low risk contacts at some of those public exposure sites are being recommended to be vigilant for symptoms. There's always a relatively modest number of close contacts, a larger number there's normally a modest number of close contacts, a larger number of casual contacts, and also a reasonably large number of people who are classified as low-risk contacts. Most of the cases we normally pick up through this process are amongst the close contacts, But in the instance that I've described to you today in relation to the plane, if we see cases amongst casual contacts, we reclassify that site and do more intense contact tracing around the cases.
So does that include the Shearwater close contact site as well? Is that related to the flight?
The Shearwater close contact site is one of the places that was visited by one of the people who were, one of the people who came off that flight, yes.
Were the people who subsequently tested positive to COVID after that first case on the flight, were they sitting close to that person or were they further away in the plane than is usually the case?
They were further away. That's why they've been classified as casual contacts rather than close contacts. There's a long practice of applying what we call the 2x2 rule. So you look at the people who are 2 rows behind, 2 rows in front of the case, and in the same row as the case, because generally that's where, if transmission occurs, and it's not common for transmission to occur, it's usually amongst those key people. But we also put the alert out to the broader number of people on the plane just for circumstances like this. The other thing to bear in mind is that when people take plane trips, they'll often queue to get on planes, perhaps be in waiting areas, and there are circumstances where they may mix quite closely with each other that don't actually reflect where they were sitting on the plane.
And if they're eating and drinking, obviously they'll take their masks off. So how does that change the spread of COVID throughout the plane?
People have been eating and drinking on planes actually for most of the COVID pandemic. We have to enable people to eat and drink. But just as we're going to be requiring people in hospitality venues in Tasmania, you can take your mask off to eat and drink. You put it back on as soon as you've stopped.
I believe the Premier mentioned that 11 people are going through the COVID at Home program and another 2 people are in community management. What's happening with the 14th person?
One person is at home and is not being managed actively through the clinical care network of COVID at Home. But they have contact numbers to ring up if they have any concerns, and they're followed up to make sure they have the relevant kind of the testing at relevant times and are recovered in a way that they can be released from their isolation requirements.
We're hearing some people interstate are waiting up to 5 days for test results to come back. Obviously here in Tassie, for people coming from high-risk areas, they need to factor in 72 hours to get their test done before they enter the state. If there's a wait time of up to 5 days in some places interstate, should people be reconsidering their travel plans to come here?
I think people need to try and factor in the timing of the tests and the test results. I think at the moment there's a very significant peaking of test demand in the mainland states, and that's partly because there's a fair bit of disease circulating in the mainland states, as there is in New South Wales. It's also a reason why we want the people to get the test, because if there's a substantial risk in the community, it's even more important that they get the test. But that's something that's actually being considered at a national level. It's not just people coming from Tasmania. There is a bit of a stress on the testing system at the moment. We acknowledge that.
Steve Old from the Hospitality Association wants a dispensation to be given to staff working in kitchens in hospitality venues to not have to wear a mask when they're at work. Would you be comfortable with that? Is that something you would consider could be safely done?
It couldn't be safely done, no. I think people working in kitchens without masks poses a risk of taking out the whole kitchen if you get one case amongst them. So I don't think that's a prudent approach for businesses to contemplate.
Would you like the federal, or I suppose, do you want or do you hope that ATAGI will recommend bringing forward the timeline for booster shots, shortening that period that people have to wait? Do you think people should be able to get their booster shots earlier than 5 months?
That's a question for ATAGI. I have the greatest respect and familiarity with the people who work on ATAGI. I know they have to make difficult decisions, often with incomplete information. They'll be looking at data internationally, they'll be looking at Australian modelling data, and I have confidence that their recommendation, as it's been all through the pandemic, gets the right advice out to Australia. So I have confidence in their advice.
And just back to that wait time for people getting a test, potentially having to wait 5 days before they get their test results back. How do people sort of factor that in if, you know, they need to get a test within 72 hours, but that test may be old by the time they need to enter the state?
If people turn up and they haven't had a test within the 72-hour window frame, they would be turning up non-compliant with their entry conditions. They would be their application to enter would be considered at the border, and that's a decision taken by the Deputy State Controller.
Is there anything that can be done about that? I mean, that's obviously going to affect people being able to enter the state because of delays elsewhere.
I can't fix the systems for testing in other states.
Just quickly, Cassie O'Connor, the Greens leader, has tweeted today saying that she believes that Tasmania should shut its border again to the states that have large Omicron outbreaks, and she's saying that, you know, with under 12s not yet vaccinated, it's not safe. Are you comfortable with keeping the borders open, or would you be recommending that we do consider shutting them to states with the bad outbreaks?
When I and others provided advice to government on opening the borders, we knew that as all of Australia was relaxing restrictions, there was going to be widespread COVID throughout Australia. As it's turned out, it's the Omicron strain. That creates a couple of additional considerations. It is definitely spreading faster. The precise understanding of its severity is not yet completely clear, but the evidence to date suggests that it's not a more severe strain of coronavirus than has previously been experienced by many populations. So the fact that we're opened up, the fact that there's widespread disease in parts of Australia is what we expected to occur when we opened up. And we're prepared all along from a public health and a health system and a whole of government approach to deal with that.
Thank you, Dr. Veach, and good morning. Today I'll just provide a quick update on testing and vaccination and then open for questions. In relation to testing, all states across Australia are currently experiencing extremely high demand on testing, including Tasmania, with a surge in particularly asymptomatic testing commencing on Sunday. Now, the surge appears to be driven by people who have received a text about a low-risk site exposure, or people that are worried about new cases in the community. Now, it is critical that our testing resources are targeted to our close contacts, our casual contacts, and anyone that is symptomatic. And for a small proportion of our asymptomatic population, anyone that's directed to get a test by public health. So, for example, returning short trip travellers from high-risk areas. Now, public and private testing clinics across the state have extended their hours and testing capacity over the last 48 hours and will continue to extend this capacity to meet the current surge. Over the last 24 hours, as the Premier has noted, close to 3,000 tests were performed in state laboratories and 2,057 tests were performed in state clinics yesterday, and that doesn't include the private laboratory site testing numbers. Now, the Department of Health has been working closely with our private testing labs and pathology services to establish additional testing capacity across the state. The Premier has noted the additional site at Youngtown, which will open from today, from 12 o'clock to 5 p.m. And Launceston will now have 4 sites operating: Dowling Street, Wellington Street Private Laboratories, Launceston Respiratory Clinic also on Wellington Street, and Youngtown. Additional resources are being allocated to our central test booking hub to support the increased bookings, and I can report that at the moment there are no additional delays being reported on the time between test taken to result being provided. Now, a key element of our testing strategy has been to establish an alternate workforce that can assist with surge activity and free up our nursing and our assistants in nursing workforce that are also very busy with a vaccination surge that has also occurred in the last week. And on top of our existing surge testing workforce, we're in the process of training and onboarding an additional workforce over the next fortnight. And once this team is on board, we'll have an additional 100 testing staff available to work in our clinics and our mobile bus sites if required. And as Mark has noted, with updated testing requirements, from today, anyone who has been in Tasmania has then travelled interstate and spent time in a high-risk area and then returned to Tasmania within 7 days has up to 72 hours to get tested after they return. And the previous direction had stipulated 24 hours. This decision has been made to ensure that we are focusing our testing efforts on the people who are identified as close contacts of confirmed cases or casual contacts as directed, or people who are symptomatic. However, in every situation, as the Premier has noted, regardless of the time frame, if anyone experiences COVID-19 symptoms, no matter how mild, please get tested and isolate until you receive a negative result. On vax, as over the weekend we passed the impressive milestones of 900,000 total vaccinations given in Tasmania, and importantly 90% of people aged 12 and above fully vaccinated. However, there is still more work to do. We have 20,000 Tasmanians aged 12 and above without a single dose of vaccine, and 21,000 who still need their second dose to become fully protected. And we really want to close that gap between first and second doses to reach 95% of people fully vaccinated. So please come forward and get your second jab as soon as you are due. In the last 10 days, we've seen a big rise in demand across our state-run vaccination clinics, our GPs and our pharmacies after the reduction of booster interval from 6 months down to 5 months. We've delivered almost 37,000 boosters, with over 13,000 future boosters in state clinics already booked. To meet this demand, we have put on 10,000 extra appointments at our state-run clinics in December, and we will be running clinics over the Christmas period. So whether you need your first or your second dose or a booster, please, there are lots of appointments and plenty of appointments in January, so please book in. Just to finish, on our 5 to 11s, more than 8,000 children have already booked in for an appointment for January, but we'd like to see this go even higher and maximise the number of children with protection against COVID before the end of the summer holidays. So we'll be adding in more locations in the coming days to ensure that parents and children have that easy and convenient vaccination access.
What is the current wait time for, or average wait time for test results at the moment?
So we usually advise people that when you get your test to expect between 24 and 48 hours for test results, but we can experience anything between 5 hours from test collection to test result being texted to you, and we're probably seeing more into the 24 hours at the moment. So it really does vary as to the location of your test, and we've got couriers that are running from the northwest and from the north on really regular intervals to make sure that our laboratory is processing those tests through. So our labs are certainly not reporting any kind of delays in terms of their processing and the time to get that text message back to you.
So even if we see an extra demand for testing, you're not really anticipating any delays in testing results?
So the key message on testing at the moment is to make sure that you do check our website on our exposure site information, and to not panic because you may have been to, for example, a low-risk site or a low-risk exposure site. So the advice on that for low-risk sites, as the Premier has walked through the 3 different types of exposure sites, for low risk is to just monitor for symptoms and to only get tested if you experience any symptoms. So I think what we've probably got at the moment in terms of our surge, we're heading into the biggest travel week usually of the year in terms of our pre-Christmas travel. We've got people that are really worried about Christmas and are wanting to make sure that they're safe and okay. And the important message there is if you have symptoms, you need to get tested. But if you have no symptoms, you haven't been in contact at a close contact or a casual contact site, there really is no need to get tested because that is going to then delay others who are symptomatic and do need PCR testing to get tested.
And if that demand does continue though, are you anticipating that people will need to expect a delay in their test results?
Well, at the moment we are working to bring on additional workforce, so we're assuming that this surge is actually going to continue through the next fortnight period, and we're preparing for that. So we have had a surge workforce already in place, and we're now surging to the areas, because what we can't plan is where COVID positive cases will actually turn up in the community. So we then respond to that demand. We hear from public health that they're listing particular exposure sites, and then we try and push testing resources to respond to that. Hence the 4 sites, for example, that are now open in Launceston to make sure we're getting through those tests.
Both you and the Premier have outlined extra resources that are being allocated to the testing clinics as a result of the demand, but we are still hearing about, for instance, someone just texted me who is 24 hours later still hasn't received a call back to get an appointment for a test. We've heard that people are being turned away from the showgrounds today, that it's already at capacity there. So would it be correct to say that the testing facilities are currently struggling with the demand?
So we probably have two, a little bit of confusion between our private laboratory sites and our state-run sites. So our private laboratory sites have only opened up on the 13th of December. So they're working through and tweaking in terms of their processes and also testing what the demand is, so they know how many staff to bring on, what their opening hours are, etc. So they have periods and they can judge, and they're drive-up only, and they can judge how many they're actually able to process. Our state clinics, however, are bookings only, and in terms of the number of referrals which are currently sitting in our testing hub, we have over 50 staff at the moment that are processing those referrals, so we'll get to people as soon as we can.
Are there plans to have testing facilities, public testing facilities in, I suppose, more regional areas? So we're hearing from a lot of people who might live in the Midlands, who live in the southeast and so on, who don't have ready access to transport, that some of them do have to get tested and there's nowhere near them that's accessible to them to do that.
So if people are in a regional area and are concerned, they should ring our public health hotline. We have got regional capacity for testing, for example, through the use of our GP network, through Primary Health Tasmania, our district hospital sites that are available across Tasmania, so we can arrange a test. For example, if you're in the Midlands or if you're in Strawn, for example, and require a test. So please do contact the public health hotline if you've got symptoms and are concerned and need a test.
We are also hearing about people getting mixed messages from some of the direct messages. For instance, a doctor who was on a flight where there was a COVID case whose daughter sitting in the same row as him got a message that she was a contact and he didn't. Are there any sort of kinks being worked out of that system?
It will depend, of course, in terms of the information that's contained on flight manifests. Sometimes in terms of mobile numbers, for example, if I, for example, do the bookings for flights for my family and list my mobile number against it, it will depend on the information that we receive. But, ask everyone. That's why we actually publish our exposure sites so publicly, and to speak to one another that you're travelling with to make sure that people have the right information. But we'll continue to receive that feedback and always happy to improve our processes.
I got a text message yesterday that said exposure site between 9:10 and 9:30 p.m, but I was at the airport in the AM, so I thought, is there an error in the text message? What do you do then? Do you call the public health hotline or do you respond to the text message?
So the first thing that you need to do is to check your Check-in Tas history and to look at the time. And if you're not there at the time that's listed in the exposure site, they've probably sent out a text in an abundance of caution just to let people know that you were at this particular site yesterday and this time was impacted, so please check your history. If you're not there in that time, there is absolutely no concern for you.
And there have been some concerns around mask supplies in Tasmania. How confident are you we've got what we need?
So we have significant stockpiles of masks for medical purposes in Tasmania. We maintain a national stockpile. We also maintain a state stockpile. So we'll be monitoring if there's concerns that are being raised in particular sectors or community groups that we previously have positioned mask stockpiles, for example, in local council areas or testing or vax clinics to try and assist people that just can't get to one. We have been telling people for many, many weeks, if not months now, to prepare that COVID safety kit, to prepare for mask wearing. So now is the time to wear one.
Just a point of clarification on the mask rules. When you go to a hospitality venue, can you take off the mask when you sit down, or do you have to wait until you're eating and drinking until you can remove the mask?
So I think the mask wearing direction clearly stipulates the exemptions, and the exemption is to eat food or drink. If you're going to sit and wait for an hour for food to be delivered, which I know would not be the standard in our amazing Tasmanian restaurants, but certainly to keep your mask on until you actually need to eat or drink. But at the end of the day, it's about common sense and masks.
Premier, just on that hospitality issue, Steve Old from the Hospitality Association has been talking about, I suppose, the impact that some of his members are seeing from the mask mandate seemingly scaring off some people who plan to dine at their venues. Are you open to any discussions with the Hospitality Association around exemptions or changes to the rules for those businesses?
No, look, let me be really clear. We'll follow public health advice, and the public health advice on the mask mandate is very clear. Yeah, and what I would say to those businesses, regardless of what Mr Old says, is that wearing masks in those businesses will help keep their staff safe, help keep their patrons safe, and importantly, it will keep them open.
Was there a particular decision behind mandating masks from midnight last night as opposed to on the day our borders reopened a week ago?
Look, we take advice on an ongoing basis. You'd be aware on Friday when we spoke that we indicated that we were seriously considering a mask mandate, and then we announced it on Sunday. Look, we followed public health advice. When we opened our borders, we didn't have any COVID in the state. We do now, and so it was appropriate that we put in place the mask mandate. But I think you'd have to acknowledge that over the last couple of weeks, we have been talking about the potential need to wear masks, and that people should follow the rules that have been very clearly expressed on the COVID website now for the last nearly 2 years. If you can't socially distance appropriately, wear a mask. That's been the rule that's been in place right through that period, and we've been suggesting that people follow it now for the last month in a very forthright way.
Do you think, though, if that mask mandate came in on December 15, that could have prevented the COVID, or many of the COVID cases we've seen to date?
Well, look, in terms of masks, they will make a difference. But look, I'm not going to go into what ifs. At the end of the day, we've acted on public health advice and will continue to do so.
I understand Paul Kelly, the Chief Medical Officer, wrote to Premiers and Chief Ministers requesting that you consider a mask mandate just to prevent the spread of Omicron. Was that a huge factor for you in bringing in the mandate? No,
look, in fact, in terms of Mr Kelly's advice, which I've read over the weekend, it accords and fits very well with the advice from Dr Veitch, who, by the way, is a member of AHPPC. And so we moved on Sunday. I'd make the point that I would hope that New South Wales especially, and some of the other jurisdictions would heed that advice.
Are you willing to listen to the THA's points around masks, or do you wish they'd just suck it up?
Look, I wouldn't put it quite that way, but as I've said very clearly, I'll follow public health advice, and that public health advice is very clear. And importantly, I'd say to the THA, the key thing here is that we want to keep your businesses operating. We want your staff to be safe. We want your patrons to be safe. And wearing a mask is a very simple, very cheap way to do that. And I would hope that that they would follow that advice because it'll keep their businesses open.
Just on the Greens' call to consider shutting the borders to New South Wales, Victoria and the ACT, Dr Veitch won't be advising you to do that, but what would you say to the Greens in response to that?
I take my advice from Dr Veitch, not the Greens.
Can you give us any information about just what kind of supports are being offered to the people who are on that whole plane load of people? Presumably some of them might be visitors who are coming to stay in a hotel in Launceston, not necessarily having somewhere to quarantine. What's happening to those people? Well,
and Dr Veitch can correct me if I'm wrong, but my understanding is that flight arrived on the 15th. They've now been being declared a close contact site last night. Means that they would have been through their 7 days quarantine tomorrow, so they will just simply need to isolate and get a test, and subject to that test being negative, they can go about their business.
Based on the fact that they would all have to be fully vaccinated to actually enter the state for 7 days. Just quickly, the Glenorchy City Council has banned jumping castles in their local government area based on what happened in Devonport. Do you support that? Do you think that's a good idea?
Well, look, I think councils should make their own decisions on that. You'd be aware at the state government level that last Thursday we banned the use of jumping castles on school grounds and on Crown lands. Now, we're waiting, obviously, on the outcome of the investigation in terms of seeing, whether or not there should be further steps taken.
You wouldn't take any statewide action until you see the results of the investigation?
Well, I've just taken statewide action as of last week in terms of ensuring that a jumping castle can't be utilised on school grounds or on any Crown land or public lands. Now, in terms of local government, that's a matter for them, how they deal with this. But I would make the point, there is a coroner's investigation that the police are conducting. We need to allow that to take its course, and then based on that information, and should we receive information prior to that investigation being fully completed, if that recommends taking action, then we would take action, but we need to allow that to take its course.
Thanks, everyone.
Still alive, just give me a moment to turn off.